Assalamualaikum. I am Dr. Irfan. I am here to present my MCQ presentation, and here we will start.
Troubleshoot. Find a problem. Find the problem in the remote.
A patient came to the emergency department due to a road traffic accident. Left leg, X-ray showed tibial fracture. Doctor on the duty applied plaster of Paris in the tibial fracture. After 2 days on the affected leg, the patient has decreased sensation, extreme pain in the extending knee. What should you do? The option, the plaster of Paris, elevate the limb, reassurance of the patient, and keep the analgesic. So, Hassan, what's the answer?
A.
Why?
Split plaster of Paris.
So, what's the problem?
As we see, there is a leg X-ray showed a tibial fracture. Doctor on duty applied plaster Paris in a tibial fracture. So there is also in an option split plaster of Paris.
So, what's this condition is called? Nerve injuries, 3 types. You know, neuropyrexia. There is demyelination due to continued pressure on the nerves, lead to the demyelination of the nerves. That's why there is decreased sensation, extreme pain, and the problem in extending the knee. So that's why we should split the plaster of Paris. We have to decrease the pressure on the nerve. A patient came to the OPD with complaint of high-grade fever and find hand joint pain. Patient has history of traveling to the tropical region. Lab shows dengue. Positive CBC show the hemoglobin 11 and platelets 50,000 WBC 5.7. What advice would you give? Mubashir.
Transfusion of platelets, as platelet level is low.
So in this patient there is low platelet. That's why we will give prophylactic platelet transfusion, because in dengue fever there is destruction of the platelets which lead to the thrombocytopenia, and that's why which lead to hemorrhagic complication. We have to prevent this hemorrhagic complication. We give prophylactic platelet transfusion. And next, third is a gardener present in the medical OPD with a complaint of dizziness, confusion. Patient has a history of taking anti-malaria drugs. Which drug causes these symptoms? How's that?
These symptoms are caused by nephropathy. Because if we talk about artesunate causes a hemodynamic emergency in G6 period deficiency. Chloroquine causes photophobia and other symptoms which also is not given G6 PD. And as far as doxycycline causes nephrotoxicity. Exactly.
Very good. So these are the complications and adverse effects of the drugs. Mefloquine causes dizziness, confusion, nightmares, and chloroquine causes photosensitivity, nausea with cramps. Artesunate causes hemolytic crisis in individual with this G6 PD deficiency, and doxycycline causes nephrotoxicity and hepatotoxicity. So which of the following is non-absorbable suture? Amen.
Because others are absorbable sutures.
And the other are the absorbable. Chromic gut, recoil, and monocoil are these are the absorbable sutures. Which one of the following is a feature of low motor neuron lesions? Adnan?
Place at paradise.
Flaccid paralysis. And why? And the spastic paralysis, Babinski sign positive, and hyperreflexia. These are the signs of sign of upper. These are the signs of upper motor neuron. So we can differentiate here lower motor neuron lesion. There is atrophy of the muscles, fasciculation, hyperreflexia, flaccid paralysis, Babinski sign negative. But in upper motor neuron, everything is going up. Like there is atrophy absent, fasciculation absent, hyperreflexia, spastic paralysis, and Babinski sign positive, seen in upper motor neuron. 6. A laborer came to the OPD with complaint of knee joint pain and flu-like symptoms on examination. Red ring with centralized clearing patch, bull's eye appearance rash as present on his right shoulder. What's your diagnosis? So, Adnan.
The flu-like symptoms and red ring with central loci are seen in Lyme disease, which is caused by the Borrelia burgdorferi.
Okay. So, what's the any cardiac complication caused by this?
Cardiac complication.
Maybe block, myocarditis, like this.
Inflammation.
So this is Lyme disease. There is erythema, migraines, flu-like symptoms, arthralgia, and facial nerve palsy. Pathogen, Borrelia burgdorferi, and we can diagnose on the Western blot test and ELISA test. Treatment of this pathogen is doxycycline and amoxicillin. A 2-year-old baby girl came to the pediatrician OPD with complaint of congenital bilateral ptosis. Which is the best treatment option? Nasir.
Surgery.
Yes, surgery. Why not eye drops, botox injection, and oral antibiotics?
Because it's more congenital, so
Thank you. So it's the congenital. That's why there is no problem in muscles and other things. That's why the definitive treatment of this condition is surgery. And a 32-year-old man diagnosed as a case of cavernous sinus thrombosis 2 weeks ago consulted his neurologist for the complaint of lateral restricted movement in his right eye. Most likely is the policy of which nerve? Right fourth nerve, right sixth nerve, left lateral rectus muscle, right medial rectus muscle. Atabzi.
right 6 months.
Right
6 months.
sixth nerve. So which nerve muscle affected?
The right lateral rectus.
Lateral
Rectus.
rectus. Do you know anything about cavernous sinus? Cavernous sinus thrombosis. Rema, what is cavernous sinus thrombosis?
Cavernous sinus thrombosis is the from the areas like from these are the sensitive area from there, then fetching spread to the cavernous sinus, and the most common bacteria is Staphylococcus aureus. It causes coagulation of the blood and causes thrombosis there, due to which we got cavernous sinus thrombosis. And in it, the lateral rectus muscle from the right eye is affected. So the answer is right 6 now.
Right, so is in this condition the area of abduction nerve palsy is the most common cranial palsy in the cavernous sinus thrombosis, and so which supply the lateral rectus. And etiology there is trauma, cavernous sinus thrombosis, and diabetic nephropathy, neuropathy. Key feature of abduction palsy, there is horizontal diplopia that person when looking at the distant object, medial deviation of the affected eye. So treatment eye patches, corticosteroid and botulinum toxin we can give to this patient. And the next one is a patient came to the OPD with a known case of myasthenia gravis, double vision instinctive movement of the right eye. Which type of muscle is involved? Miraj.
Medial rectus.
Medial
It
rectus.
is case of the strabismus squint.
Yes, very good. So in this condition, it's a case of strabismus, medial rectus abduction, adduction of the eye, weakness, oculomotor nerve palsy, lateral rectus weakness, abduction nerve palsy. And a 9-year-old child came to the ENT OPD with the complaint of ear pain and discharge on the right side. On examination, verbal test positive. Conductive hearing loss. What's your diagnosis? Aziz. Otitis external. So you know what is the Weber test? So it's a test we perform to exclude between two conditions, conductive hearing loss and the yes. And it's a case of otitis externa. The most common cause of otitis externa is pseudomonas aeruginosa, common in swimming activities and staphylococcus aureus. So there will be severe pain, otorrhea, intense itching in the external aortic canal, conductive hearing loss. Treatment is a topical treatment and antibiotic air drops, ofloxacin, ciprofloxacin, gentamicin, and topical preparation with the corticosteroids. A 22-year-old woman with long-standing constipation has severe anal rectal pain on defecation. Rectal examination impossible due to pain and spasm. What is the best, most probable diagnosis? Vajah. Anal fissure. So, can you point out those points which can point out the definitive diagnosis, clinical features?
Anal fissure is due to long-standing constipation, and rectal pain, and anal fissure is due to 90% pain on defecation, and it's a painful spasm, and if it's abscess, it would have a long-standing fever. Hematoma wouldn't have that pain, only bleeding and hemorrhoids.
So, anal hematoma is not because there is no history of any trauma or any history.
Yes.
And anal abscess, there is no history of fever. And also hemorrhoids, there is no history of any swelling, any lump. So that's why we most important thing is anal fissure, which is most commonly in the posterior midline and which excludes the diagnosis. Which type of surgery may cause recurrent laryngeal nerve palsy? Harun.
Thyroid surgery.
So what's the complication if there is recurrent laryngeal nerve palsy?
Complications.
So in recurrent laryngeal nerve palsy, which is close to the inferior thyroid artery and transient, and due to the palsy of this recurrent laryngeal nerve, there is hoarseness of voice because it can lead to the paralysis of the vocal cord. Which type of carcinoma originated by striated muscles? Tahir. Leiomyoma and mesothelioma, liposarcoma, you know from where they originate? Adil? Leiomyoma, smooth muscles, and mesothelioma. Where is the mesothelium present?
is the
mesothelioma. So neumyosarcoma originates from the smooth muscle and mesothelium present in the pleural cavity. And so in malignant carcinoma originates from there is called the malignant mesothelioma, which is associated with asbestosis. And liposarcoma is originates from the adipocytes. This organized growth of cell often a precancerous stage of growth, which term is used for? Hamid. So what is metaplasia? Aslam.
One type of.
And what is hyperplasia?
Increase in number of cells.
Increase in number of cells. And what is hypertrophy? Atrophy.
Atrophy means decreased size.
And hypertrophy.
Hypertrophy, increased size of cell.
Okay, thank you so much, Dr. Irfan.